On behalf of the Velo CMC Foundation, welcome. So it's a pleasure to introduce our guest today, Dr. Ankit Bharat. Ankit is from the batch of 1997 and is a Harold and Margaret Method Research Professor of Surgery and the Chief of Thoracic Surgery at Northwestern University. He's also the Surgical Director of the Lung Transplantation and Respiratory ECMO. So Bharat, welcome. Tell us a little bit about yourself and how you came to be the professional you are.
I was raised in a town called Meerut up in North India, and my family consists of a lot of physicians, actually. Both my parents are high school. I was looking at the right medical school. My dad strongly advised me to apply to Christian Medical College. At that time, Christian Medical College was only allowing about 7 candidates from the open general category. But I did tell him that there is, no possible way I could make it to that top 7. I mean, I was a fine medical student. I mean, a student in high school, but I was not, in the top of my class. And then I was fortunate to be in one of the 7 that they offered the position, and I decided to stay with CMC and not pursue the UPenn idea. I was quite exposed to the idea of research. I'd worked in some of the hematology lab, and some of my mentors, Dr. Ramakrishna, who was also my foster family, he was writing a lot of papers. He had, a number of important papers in the field, including one in Lancet. And then Dr. Kang was there as well. She was very supportive of research. And then Dr. Maman Chandy, who had run a very successful hematology program in CMC. And I think there were very few medical schools at that time that gave you that exposure of just investigative medicine and fostering that culture of science. So as I finished my medical training, I really wanted to have a clinical career that focused on basic sciences as well. And unfortunately, I didn't quite find an opportunity to do that after my medical school, and therefore I decided to come to US. I came to WashU in St. Louis, and then once I finished my surgical and cardiothoracic surgery program and training programs, I joined Northwestern Medicine in Chicago about 9 years ago. And I mostly came to Chicago. I didn't know anybody. I didn't have relatives. I'd never been to Northwestern. But the interesting thing there was Northwestern had no lung transplant program. So I thought it would be a great opportunity to start that. One of my mentors at WashU was Dr. Alec Patterson, who was a world-renowned surgeon in cardiothoracic field. In fact, he was the person who did the first successful double lung transplant in 1986 in Toronto. So I was quite inspired by him, and he took a lot of interest in me personally and trying to train me. So lung transplant was going to be an important part of my career. I wanted to, besides, thoracic surgery, I wanted to really be impactful in lung transplant also. So coming to Northwestern gave me that opportunity to start a lung transplant program and then shape it the way I wanted to do. And then, I started that program. I came here in 2013, and then I did the first lung transplant at Northwestern on Independence Day, July 4th, 2014. And now we are the largest program in the state. We're the most well-known program.
So, about 6 months ago, you did the first double lung transplant in a COVID patient. Can you tell us a little bit about how that came about and what drove you to that decision?
We got the lung transplant program going about 6 years ago. One of the visions of the program was to always think about innovation. So when this pandemic hit, I was one of the members of the task force for COVID. And in my capacity as the head of thoracic surgery and the director of transplant and ECMO programs, was seeing a lot of patients who were progressing to permanent lung damage and then ultimately dying from the complications of COVID. So we thought, if in the right patient, if we could establish permanent lung damage and then establish that the virus has been cleared from the body, we could possibly help them by doing a lung transplant. Now, so by April, I would say mid-April, we were able to open up some of our basic science labs, and we started working quite aggressively trying to develop certain techniques in the lab that would allow us to answer those two questions. Question number one being, has a permanent lung injury occurred in the patients? And then secondly, has the virus left the body? And then technically, I needed to understand whether this can be even done. What does the inside of the chest look like after the COVID has destroyed the lungs? So I started this program of warm autopsies in patients. And then we had developed a couple of techniques, including something called matrix imaging that studies the architecture of the lung. And for the first time, we found that in some patients, you have you end up developing, these patients end up developing permanent lung damage. And then we did a lot of work with single cell RNA sequencing using, highly sophisticated technologies. Then we developed some artificial intelligence based or machine learning based algorithms to then ask, how do we predict or how do we recognize patients who have permanent lung damage? So we discovered these cells called keratin 17 cells. And then doing the autopsy gave me a really good idea about what the inside of the body looks like. But we had to develop another technique to be really sure, something called RNA-scope. So with RNA-scope, we can use a sense and an antisense probe to not only visualize the virus in the lungs, but also whether it's replicating or not. So once we combine all this information, then we could identify patients who have permanent lung damage and then patients who have cleared the virus, and then get them to transplant. So ultimately, it stemmed from recognition of a necessity and seeing a lot of these patients die early on.
Tell us a little bit about your research and how it's the flip side of the coin of your technical work that you do in thoracic surgery.
Share a story with you, which I haven't told many people. So, and I share that story only to emphasize how important research can be. In the career of a clinician. So when I came to Northwestern, I didn't realize. So Alec told me that, Ankit, if you come to Northwestern, if you're successful, you'll be the first trainee to come out of a fellowship and start a lung transplant program from scratch. But then if you're not successful, you'll also make history because you'll end your career very soon, and you'll be my trainee with the shortest career in surgery. So I put the program and I went together and built the team, and I had really good support, and then finally did the first transplant, as I mentioned, on July 4th, 2013. And that patient, the surgery went well, but about 10 days into the transplant, developed a problem called hyperammonemia syndrome. And that affected 5% of all lung transplant recipients globally, and it kills them. So I called Alec, and Alec said one of the early patients that he transplanted in 1986 also had the same problem and died. And for over 30 years, there was no solution to this. People thought this is because of inborn error of urea cycle metabolism, but it didn't explain a lot of other things that these patients experienced. So I took that observation to the lab. Now it led to discovery of this organism and a cure for a lethal problem, that was killing about 5% of lung recipients every year. So now no one dies of it. So I think, having basic science or any kind of, I do basic science, but I don't think, investigation is limited just to basic science. Whatever research, whatever your passion is, I think that just gives us that one extra tool to ask, those questions and have that tool to, find answers.
In many ways, you've excelled in the path that you have chosen. Do you wonder what if you'd taken the alternative path and gone to pre-med at UPenn, where you would have been and how you would have been different?
I don't actually ever think about that because I feel that, going to CMC was such a perfect decision for me. There were certainly, I would have come to US earlier and, there were some advantages. UPenn is an Ivy League school and stuff. But, the person I ended up becoming, is largely in part of CMC. And I learned so many things in CMC, which I don't think I could have learned anywhere else. You're exposed to some of the most cutting edge technologies at the main hospital, but then you're also getting posted in some of the most underserved villages, and you have to come up with, just creative solutions to help people. So no, we didn't have solutions all the time, but, working in a really rural community hospital and having to deliver a child with a twin pregnancy with minimal resources, and trying to do your best, actually, it helps you understand the importance of innovation and not just take resources for granted and feel entitled about it. I do think that every mentor that I had in CMC did want to do the right thing. I never felt that, it was about financial pressures or it was about, anything but just providing the best quality of care to the patients, and for my mentors to provide the best quality education to their students. So I don't know. I just think that I don't look back what would be, but I cannot. I'm 100% convinced that going to CMC was absolutely the right thing for me and played a big role in where I am today.
Well, I can tell you on behalf of CMC that you are an inspiration and that you have lived the motto to serve and to do it with excellence in so many different dimensions. So, Ankit, thank you so much for sharing your time and your life with us.
Thanks a lot.